Dr. Baliga here. This podcast is on the possible role of vasoactive intestinal peptide in checkpoint inhibitor-induced myocarditis. I postulate this after reading a letter in the New England Journal of Medicine, June 25th, 2020 issue, where a letter in this issue of the New England Journal of Medicine reported the possible role of vasoactive intestinal peptide in checkpoint inhibitor-induced pneumonitis. Vasoactive intestinal peptide (VIP) is a 28 amino acid neuropeptide with a broad distribution in the body and with diverse cardiovascular effects that include vasodilatation of cerebral and coronary artery circulations and an improvement in myocardial contractile performance. Endogenous vasoactive intestinal peptide seems to exert cardioprotective action because myocardial VIP depletion is related to the development of cardiomyopathy and myocardial fibrosis, and low VIP circulating levels are directly associated with adverse prognosis in chronic heart failure. In contrast, VIP exerts a regulatory role in the homeostasis of the immune system. VIP is a potent anti-inflammatory factor that affects both innate and adaptive immunity, and many studies with experimental preclinical models have demonstrated the efficiency of VIP in the therapy of autoimmune disorders, including Sjogren's syndrome, inflammatory bowel disease, experimental autoimmune uveitis. Various studies demonstrate that the therapeutic actions of VIP are mainly exerted through the coordinated regulation of a balance between cell-reactive T cells, mainly Th1, that is T helper cells 1, and Th17 cells, and regulatory T cells or Treg cells, and their products, the modulation of dendritic function, and the deactivation of inflammatory macrophages. Evidence also indicates that these immunoregulatory mechanisms could be exerted in patients with autoimmune disorders. In the New England Journal of Medicine, in a 68-year-old man who was treated with pembrolizumab for advanced melanoma, the authors of this article treated the patient with checkpoint inhibitor-induced pneumonitis with the inhaled formulation of synthetic vasoactive intestinal peptide at a dose of 70 micrograms 3 times daily as an alternative treatment to avoid glucocorticoid-related side effects and systemic immunosuppression. Vasoactive intestinal peptide has been shown to dampen type 1 helper T cells responses by inhibiting effector T cells and boosting regulatory T cells through its G protein coupled receptors, the VIP receptors VPAC1 and VPAC2. Numerous reports indicate that binding of VIP to VPAC2, but mainly to VPAC1 in macrophages and T cells also initiates a complex cyclic AMP PKA mediated signaling that regulates activation of kinases and transcription factors like NF-kappa B, P38 MAP kinase, JAK-STAT1, between others, that are critical for the production of inflammatory mediators, activation of type 1 T helper cells and type 17 T helper cell responses, and the generation of T regulatory cells. Moreover, various studies have involved cyclic AMP PKA signaling in the induction of PPR gamma ABCA pathway. Furthermore, previous studies suggest that VPAC2 is the receptor mainly involved in the effect of VIP in cardiomyocyte protection and myocardial fibrosis. In the patient with checkpoint inhibitor induced pneumonitis, Treatment with the inhaled vasoactive intestinal peptide resulted in radiological and clinical improvement in the lungs. Analysis of the BAL fluid showed reduced alveolar lymphocytosis with reduced CD28 expression and increased T regulatory cells, spontaneous and lipopolysaccharide-induced release of tumor necrosis factor reflecting the inflammatory alveolar milieu were dampened during therapy. Moreover, VIP peptide therapy was not associated with toxic effects and did not influence lymphocyte subtypes in the peripheral blood. 8 weeks after stopping therapy, the patient had systemic non-pulmonary progression of the melanoma. The authors went on to say that their findings support VIP as a local therapy to reduce alveolar inflammation in patients with immune checkpoint inhibitor pneumonitis. In another paper in the Journal of Immunology 2018, volume 200, pages 3697 to 3710, the paper is titled Vasoactive Intestinal Peptide Ameliorates Acute Myocarditis and Atherosclerosis by Regulating Inflammatory and Autoimmune Responses. The lead author is Raquel Benitez, and the senior author is Mario Delgado, both from Spain. And the pathology is done by Dr. Andrew Lichtman from the Brigham and Women's Hospital. This paper reports that in an experimental model of myocarditis, autoimmune myocarditis, in susceptible BAL-B/C mice, VIP intraperitoneal injection reduced the prevalence of myocarditis, ameliorated signs of heart hypertrophy and injury, attenuated myocardial inflammatory infiltration, and avoided subsequent pro-fibrotic cardiac remodeling. This effect was accompanied by a reduction of type 17 T helper cells driven cardiomyogenic responses in peripheral lymphoid organs and in the levels of myocardial autoantibodies. Connecting the dots between these two papers, the next step would be to see whether VIP is beneficial in an animal model of immune checkpoint inhibitor-induced myocarditis, and probably as an adjuvant to steroid therapy in immune checkpoint inhibitor myocarditis, particularly since this medication can be given in an inhaled form.